kindly ask that you keep your questions related to today's topic. When asking a question, please state your name and publication, and please keep your questions as short as possible so we can get to as many as we can in the time that we have. Any additional questions can be sent to media@hhs.gov. With that, I'll turn it over to the Secretary.
Hello, everyone, and thank you for joining this week's Operation Warp Speed briefing, the first of 2021. To begin, I want to underscore what we've achieved so far. Having 20 million doses of vaccine available for jurisdictions to order by the end of 2020 was an historic achievement and a tribute to the success of Operation Warp Speed. This week, we have allocated another 4.1 million doses for jurisdictions to order, and nearly 20 million doses total have now been physically distributed. But we all know and agree that the ultimate goal is not vaccines in warehouses or freezers, but shots in arms, helping to protect American lives. We've already seen the rate of vaccinations increase substantially in recent days, and in the coming weeks we expect that pace to increase even more. We knew that would be the case from the way that states drew up their plans in cooperation with CDC, but we're not going to wait around and see. We've been examining the challenges that might have slowed the ramp-up of administrations over the last several weeks. We're taking immediate action, and we're laying out ways for states to speed up administration even more. First of all, we've announced an early launch of the federally arranged pharmacy partnership, which will eventually cover more than 40,000 pharmacy locations from 19 chains and associations across the country. This partnership allows states to allocate vaccines directly to these partners, and these partners can then administer vaccines to particular groups, like those over a certain age or in certain occupations, and eventually to the general public. The plan had been to ramp up this partnership over time because vaccine supply would not be sufficient to spread across all of the pharmacy partners right away. But to help give states as many options as possible for vaccine administration, we're launching the program this week, and states can choose particular partners to send vaccines to now. These partners can provide rapid access to vaccines in settings that may be more convenient and efficient than partners they've used so far, like hospitals. We know some states have already been allocating vaccines to pharmacies. This partnership offers a new, easy option because we've already enrolled tens of thousands of pharmacies into it, and CDC is already sending out information to help states think through how best to use this partnership right now. States can also accelerate vaccine administration by moving on to providing vaccinations to broader populations right now. There is no reason that states need to complete, say, vaccinating all healthcare providers before opening up vaccinations to older Americans or other especially vulnerable populations. I'll quote what Dr. Messonnier said on this topic just recently. We, quote, really hope that articulating these phases is not leading to unnecessary barriers. Don't leave vaccines in the fridge. Don't leave vaccine in the vial. Providing flexibility around these phases rather than proposing heavy-handed penalties for vaccine administration is the best way to get more shots in arms faster. I was just on the phone with Governor DeSantis of Florida this morning, talking about how we can further accelerate access. We would much rather see states move as quickly as possible and use every possible avenue to meet demand, as places like Florida are trying to do, than to leave vaccines sitting in freezers. It would be much better to move quickly and end up vaccinating some lower priority people than to let vaccines sit around while states try to micromanage this process. Faster administration could save lives right now, which means we cannot let the perfect be the enemy of the good. I also want to reiterate that we've already provided considerable assistance to the states and other public health jurisdictions we're working with. A federally created vaccination playbook provided in September that CDC has used to work with jurisdictions on their vaccination plans nearly every day since then. The kits with needles, syringes, swabs, and personal protective equipment needed to administer the vaccine. And $340 million for COVID-19 vaccine planning. Only a fraction of that $340 million in funding, I will note, has been drawn down by states. In addition, jurisdictions can request specific assistance where necessary for administration which could include FEMA or National Guard personnel. We believe that's not likely to be necessary given the size of the workforce available in the private sector to provide immunizations, but it can be an option. On top of that, we have billions more in funding for vaccine administration in the relief bill that the President signed last week. CDC will initially award $3 billion to more than 60 jurisdictions using a population-based formula as directed by Congress, and we're releasing more information today regarding these funds. On the therapeutic side, I want to remind all Americans that we have authorized antibody treatments available that could help keep patients at high risk for severe disease out of the hospital. We're working on more ways to help Americans access these treatments, including this week's launch of a federally supported infusion facility in El Centro, California. Right now, there are hundreds of thousands of doses that have been distributed and not yet used. If you test positive for COVID-19 and are over age 65 or have a comorbidity that raises your risk of severe disease, you may be able to receive one of these treatments, which have been shown to reduce the likelihood you'll be hospitalized with the disease. Finally, as we face rising case counts in a number of parts of the country, we need all Americans to keep up the same public health measures we've been recommending throughout this crisis. Hope is here in the form of vaccines. We just have to keep up our guard for a bit longer. Remember the 3 W's. Wash your hands, watch your distance, wear your face coverings when you can't watch your distance. And I'd like to add 2 more things. If you test positive and are at risk for severe disease, you should ask your doctor why you are not being given one of the FDA-authorized antibody therapies that may be available. And please, when a vaccine is available to you, go get a safe and effective COVID-19 vaccine. With that, I will turn things over to Dr. Slaoui to provide an update on scientific and manufacturing progress. Dr. Slaoui?
Thank you, Mr. Secretary, and hello, everybody. Just a very, very short, actually, update. First, Johnson & Johnson vaccine, as you know, completed phase 3 recruitment. We're continue to be on track for an EUA filing by the very end of this month, and also working with the company to ensure that we optimize the number of vaccine doses available in the month of February. We're very eager to see the data once available, as this is a one-shot vaccine that clearly comes with very significant advantages. Secondly, the Astrazeneca phase 3 trial here in the US is really coming to the very end. There are a few sites still recruiting, particularly around minority populations. The window for filing of the EUA, which, as you know, based on the FDA guidance, requires a median follow-up of 2 months after completion of the immunization schedule for the AZ vaccine here in the US, based on the phase 3 trial in the US. So there could be, of course, alternative strategy for EUA filing. But the filing for an EUA based on the US phase 3 trial would open in the first week of the month of March. You know, we announced last week the start of the phase 3 trial with the Novovax vaccine, which is the first protein-adjuvanted vaccine. We have now recruited 3,000 subjects, which is pretty good given that we had we had the year-end holiday since the trial started. The Sanofi program, as per the announcement of the company, is gearing towards the start of a phase 2B trial, which is planned to start in the middle of February, and we're preparing with the company for that. And finally, I think importantly, we have had the green light from the FDA on the testings, the assays, etc., for the correlate of protection identification assays, and the testing has started. It's going to take probably about 2 months to complete those testings, and hopefully we may be able to identify an immune correlate of protection. If that is done, that will be really a critical step in enabling other vaccines that cannot go into placebo-controlled efficacy trial to potentially seek approval by demonstrating their capacity to induce such correlates of protection. I'll stop there. That's the update. Of course, always happy to answer your question and pass on to my co-leader, General Perna.
Dr. Slaoui and Mr. Secretary, you can hear me all right?
Yes.
Okay, good morning, everybody. Here we are in the new year, and I just would echo what Secretary Azar and Dr. Slaoui said. I thought our secretary did a wonderful job of articulating exactly where we are with distribution and how we're working to enable the way ahead. Getting through the holiday season, working through 3 major snowstorms, and making sure that the distribution process to the states is working has really been a remarkable feat. And again, I will acknowledge Pfizer, Moderna, McKesson, UPS, and FedEx for masterful work, in particular the men and women in those organizations that are working 24 hours a day, 7 days a week to keep a steady drumbeat of vaccine. As the Secretary said, nearly 20 million doses of vaccine already delivered. We have delivered that to over 13,000 different locations throughout the United States, from the Pacific Islands and territories through Hawaii to Alaska, through the entire country to Maine, Florida, Puerto Rico, Virgin Islands, simultaneously fair and equitable distribution of vaccine to everybody, so that everybody has the opportunity to distribute simultaneously to the American people. I would tell you that it's going very well, and our goal is to maintain the steady drumbeat so that the states have a cadence of allocation, planning, and then the appropriate distribution to the right places as designated. The key is that we want to make sure that we continue to get better at execution, as the Secretary articulated. You know, how do we get the shots in arms? So we're always reevaluating the numbers, making sure that distribution is to the right places, making sure that the execution is happening so that other decisions could be made about allocations to continue the flow of vaccines into arms. I feel very, very confident in what commercial industry is doing in the distribution, and now we're going to connect it even deeper with commercial industry, as the Secretary said, aligning capability and capacity to distribute vaccines through the 19 pharmacy chains throughout the country, which will open up and broaden our places to deliver to over 40,000 locations where we already have the pharmacies enrolled. So based on plans from the states, we can initiate that, as the Secretary said, starting this week and going into the following weeks to ensure broader, deeper, wider distribution of vaccine to the American people. I would just close there with, every day we get together, every day we're assessing, every day we're working hard to do it better. It is about moving forward and ensuring that our country, the American people, receive the safe and effective vaccine as soon as it's available, so that we can get back to normal. We are on the offense, and we are pressing hard to get to our end state. So, Mr. Secretary, with that, I'll pause for follow-on questions.
Great. Thank you very much, General Perna and Dr. Slaoui. And Michael, I'll turn to you if you want to open the question period, please.
Thank you, sir. Thank you all. Operator, we'll open up for questions. And a friendly reminder, please do state your name and publication and keep your question as short as possible so we can get to as many as we can in the time that we have. I'll turn it over to you, Operator.
Our first question comes from Angelica Livido with Bloomberg News. Your line is open.
Thank you. Secretary Azar, you said that you've reviewed what's caused this slow rollout. What issues have you identified and how are you fixing them? Additionally, how many vaccines are being administered every day and how many do you expect to administer by the end of the month?
So I think General Perna actually discuss some of the factors that go into the distribution. So first off, the FDA didn't approve until really the days before Christmas. So we don't control that timeline of when the approval came through, and that's part of the gold standard was the independence of FDA's approval process. So Pfizer's vaccine was authorized and able to ship, I think it was December 14th, and Moderna's was authorized and available to ship on December 21st. Then you have, of course, Christmas and New Year's right there. So while we continued to ship, you do have just the natural human behavioral element of the holiday season there in terms of hospitals, pharmacies, and other healthcare providers being able to line up individuals for vaccination right there. So that's also a normal consequence. In addition, we have these prioritized recommendations out of CDC and the Advisory Committee on Immunization Practices. And as Dr. Messonnier has made clear, and as I am repeating today, those are simply recommendations, and they should never stand in the way of getting shots in arms instead of keeping vaccine in the freezer or ever, heaven forbid, wasting a dose of vaccine in a vial. It's more important to vaccinate, and I have encouraged our governors, and I will continue to do so, that if they are using all of the vaccine that is allocated, ordered, distributed, shipped, and they're getting it into healthcare providers' arms, every bit of it, that's great. But if for some reason their distribution is struggling and they're having vaccines sit in freezers, then by all means you ought to be opening up to people 70 and over, 65 and over. You ought to be making sure that the nursing home patients are getting vaccinated. But it's important to remember, we got 20 million doses available in December 2020, but there's always going to be a lag between available doses, then the ordering by the providers, then the shipping, then the actual administration of the vaccine, and then importantly, the reporting of those vaccinations. The CDC's and the data aggregation system there is not yet perfect or real time. There are entities that are not reporting. Here in D.C., one of the public health officials has publicly stated that 40% of the pharmacies are not yet reporting into the system. There's also a time lag of as much as 72 hours possible on those that are reporting. And so we continue to work with CDC and our states and our providers to refine the quality of data coming in. We're seeing a substantial increase in the number of vaccinations that I believe we'll continue to see, as Dr. Messonnier and Dr. Fauci have said, a continued, sustained increase in actual vaccinations as this continues. But we want to make sure a couple steps. First, make sure the governors are not being overly prescriptive about those prioritized groups. It's more important to get people vaccinated than to perfectly march through each prioritized group, even if that is their choice of how to prioritize. Two, getting to alternate site locations in addition to hospitals, getting to these pharmacies so that it makes for an easier customer-patient experience getting those vaccines out there, as Governor DeSantis, I think, has creditably done. In terms of the actual data, we don't have goals per day. I'll ask General Perna if he wants to talk about the second part of your question, which was projections per day, but especially with the data reporting coming in from hospitals, pharmacies, and states, I don't believe it's either sensible or realistic for there to be any kind of projections on a daily basis. General Perna?
Mr. Secretary, I have nothing to add. I thought you did a well job. I would say the key is we just want them to flow. And, we're monitoring both, first dose and, now second dose for Pfizer. So, to put a specific goal each day, I think is not appropriate. What we want is the vaccine to be effectively administered, and we want it to be done to the right way so that there is, so that all of it is used in a timely manner. I'll pause.
Thank you, General. Next question.
Our next question comes from Rachel Robe with Politico. Your line is open.
Hi, thanks for taking my question. I have a question about the pharmacy partnership. I was wondering if states will have control still over like the prioritization scheme of who gets those shots, and also if there's any mechanism in place to ensure that like people who sign up for shots from the pharmacies are in at least like the 1A, 1B, 1C category, and then it doesn't become kind of a free-for-all for general public.
So, Rachel, we had a great deal of trouble with static on hearing your question there. I did catch the last part of it, which was if there are any protections as we move to more retail pharmacy distribution to ensure that only people in certain prioritized groups are vaccinated. Again, the governors decide on both where vaccines should go and whether they are going to follow various recommended prioritized groups or not, or how broadly. My message is we need to not be overly prescriptive in that, especially as we see governors who are leaving vaccines sitting in freezers rather than getting it out into people's arms. The perfect cannot be the enemy of the good here. I don't know, General, if there was any other aspect of the question that you were able to hear more clearly than I.
Mr. Secretary, like you, it was broken up, but the last part I would also echo the work that the CDC has done with the 19 pharmacy chains will allow a really sophisticated approach to scheduling appointments. And so all of them have a very elaborate system. And so when it's opened up by the governors, then they will be able to, people will be able to go onto their websites, be able to sign up for specific times, and then be able to go get them. Times will be designated for both first and second shots to help manage the execution accordingly. Over.
Great. Thank you, General. How about the next question, please?
Our next question comes from Karen Weintraub with USA Today. Your line is open.
Hi, thanks so much for taking my call. I was wondering if you could talk a little bit about nursing homes. According to the CDC data, only about 13% of shots have been delivered, of delivered shots have been actually gotten into arms. And just wondering if you can talk, I know there's a delay in reporting, but can you help us understand a little bit why that number is so low and how that's going to change, how quickly that's going to change?
Yeah, Karen, thank you. I'm glad you raised the issue of the skilled nursing facility distribution. I meant to discuss that in response to Angelica's question at the outset also. So it's important to remember that with our long-term care facilities, our nursing homes, a significant number of the patients there are in a medical condition such that they aren't able to consent on their own for some medical procedures, including getting an EUA vaccine. And so there is a procedure where CVS and Walgreens, if they're the entities that the states and the nursing homes have decided to operate with to vaccinate, need to go through a process to ensure that whether it's, I think it's on average about 100 patients per skilled nursing facility, that they secure those consents, because you want to go through and do a vaccination campaign very quickly within that nursing home rather than in fits and starts. So you want to lay that groundwork to be ready to go in. And so that preparatory work started really as soon as the nursing homes opted into the CVS or Walgreens programs and has continued. The vaccine's available, and I do believe that we will be seeing significant ramp up of those vaccines getting into nursing home patients. And in fact, we are working to organize a discussion with the leadership of CVS and Walgreens with our nation's governors to make sure that there's a lot of clarity about the process there and to ensure that there's full state support on getting our nursing home patients as well as our nursing home staff vaccinated as quickly as possible. General Perna, could you give any more detail on that, please?
Mr. Secretary, I would just add that CVS and Walgreens has done over 9,000 clinics into the long-term healthcare facilities, and they've scheduled up to another 4,000 more as we're going that are already scheduled right now. And so really positive momentum throughout the country on this. Over.
Thank you, General. Next question, please.
Our next question comes from Candace Choi with the Associated Press. Your line is open.
Hi, do you have a count of how many vaccines have gone wasted as a result of spoilage or any other reason? And then are you giving guidance to jurisdictions on whether COVID testing sites should be converted to vaccination sites to speed up vaccination?
General, would you mind taking those two questions?
So the first part that we know of reported, only the vaccine from Wisconsin that was in the news already, the 500 plus doses, is the only report that we've had of wastage as of right now. Over.
Thank you. And do we have any guidance that's been offered regarding some of the states have set up COVID testing sites? Have we provided any type of guidance to them regarding converting those sites to vaccination campaign sites?
We have not, Mr. Secretary, but of course, the option up to the governors to execute accordingly is available. Over.
Yeah, Candace, the one thing I would just say, of course, the governors can do whatever they would like in terms of setting up these distribution systems. What we've tried to do, though, is as much as possible to leverage the system that we have. It's a quite developed system in the United States for vaccinating people that really relies not just on our hospitals and our nursing homes for patients there, for the staff at those facilities, but also and for our staff, but also just the retail pharmacy chains that are so expert and so available throughout the United States. And that's where the next big push is to bring those online and make sure the governors have those available, really to hopefully expand out to much larger swaths of individuals, especially any individuals who are at risk of hospitalization, as we work to try to prevent individuals from going into our hospital with any of the tools that we have at our disposal, whether it's vaccines or monoclonal antibodies, and of course the 3 W's of prevention. Next question, please.
Our next question comes from Meg Tyrrell with CNBC. Your line is open.
Hi. I just wanted to follow up on Angelica's question about sort of the pace of vaccinations. I know you mentioned, by the end of the month, maybe not a good time to give a guide for what you're expecting per day, but Dr. Collins from the NIH this morning set a benchmark. He said a good one would be 1 million vaccinations per day. So if we were doing that pace, it seems like it might take us about a year and a half to get to 80% of people getting 2 shots. Is that the kind of pace we should be expecting? Do you expect to beat that 1 million benchmark, vaccination per day goal? And then I also wanted to ask, is the hesitancy that you've been hearing about for healthcare workers in particular or people in nursing homes, is it higher than you expected in terms of getting the shots? Thanks.
Can I ask General or Dr. Slaoui if you want to address either of those questions?
I think just to reinforce, our goal is to make sure that vaccine is effectively available, and we want to administer as much as possible, as quickly as possible, as long as it remains safe in execution. And I think even targeting a goal, we want to get beyond that as fast as possible. So hence, we started out with the nursing homes and the medical folks, very deliberate execution in certain locations that had to be executed at those locations. Now we want to expand, as the Secretary said, to the pharmacies, to over 40,000 pharmacies, which allows greater access and availability and multiplies significantly our ability to administer shots in arms. We do believe, I believe, that there will be, as we monitor and we keep watching ourselves and learning, that we're going to want to expand into larger type facilities down the road, but not initially, as we progress into execution to ensure the safe and effective use of the vaccine. So there's great potential to meet that goal, but I wouldn't constrain ourselves with a goal. We want to get vaccines in the American people as rapidly as possible.
Yeah.
Over.
And The rate limiter, as we would say, there is manufacturing and availability of doses, and that's why we talk to you about available doses, which then trickle through available to orders, to distribution, to vaccinations, to reporting data on those. And especially as Dr. Slaoui talked about earlier, if the Janssen J&J vaccine does report out positive data and does secure FDA authorization, the wonderful thing about that, two wonderful things about that vaccine if that becomes available. First is that it is a single-dose vaccine, and so every dose is a protected person. Second is that the manufacturing processes and platform of that Janssen vaccine is an incredibly scalable manufacturing platform, and so that's another very positive aspect, again, assuming that data comes in positive and assuming it meets FDA's standards for approval and authorization. Next question, please.
Operator, we have time, I think, for two more questions.
Our next question comes from Max Baer with the CBS News. Your line is open.
Hi, thank you guys for this briefing. I know people have been asking about the pace of things, so I just want to confirm some past numbers that were thrown out if we should still be reporting these, and that was an estimated 50 million doses delivered by the end of this month and 100 million doses by the end of February. Are those still accurate projections?
General, would you mind discussing?
I think to work backwards, by the end of the quarter, for February, as the Secretary just talked about, January, as the Secretary just talked about, first, we're monitoring the manufacturing and the capability and the capacity. As we've talked many times, very delicate, deliberate process as we go forward. And so we're only allocating what's been released to us. For planning right now, I have a target of at least 20 million doses for Pfizer and 20 million doses for Moderna. Again, for planning early in the month. So I think that for now, I think it's a good number to get to. We believe also by the end of the quarter, that which is March, that both companies will meet their requirement for 100 million doses each, as they signed up for. But again, it will depend on how everything goes with manufacturing as we go forward. I'll pause.
Great.
Over.
Thank you, General. I believe last question, please.
Our next question comes from Nick Slorko with STAT. Your line is open.
Hi, thanks so much for doing this. General Perna and Dr. Slaoui, since we're now very close to January 20th, I'm wondering, have either of you been asked to stay on in the Biden administration, or have you been given any indication that you will be asked to stay on? Thanks.
Well, we go. How about General Perna first as remote, and then Dr. Slaoui?
I've signed up. I'm here until my part of the mission's done, or I'm told otherwise. I have not been informed one way or another officially. Over.
Dr. Slaoui?
I have, two things. One, I had said earlier in December that once 2 vaccines are approved and 2 medicines are approved and in use, it would be the time for me and the rest of the pipeline, progressing, time for me to consider going back to my private activities. I have decided to extend that in order to ensure that the operation continues to perform the way it has performed through the transition of administration. I have been in contact with, as we all have been, I've been contacted by the new administration, and I have been asked to become a consultant after the time comes when the transition happens, which I have accepted to do. My mission from May 15 has been to ensure that we have vaccines and medicines as quickly as possible for the American people and for the world, and I'll continue to support as needed. I think we're getting close to the point where my value add is more limited, and therefore I'll expect my activity to decrease gradually after January 21st. But as long as I'm asked, I will be helping.
And as we close, I just want to express on behalf of myself and I'm sure on behalf of Acting Secretary Miller at the Defense Department, our just deep appreciation on behalf of our departments, the administration, and the country to Dr. Slaoui, to General Perna, and to Carla de Notari Stefani, who leads all of our manufacturing efforts, for their incredible, selfless service to the American people, and through their labors and the labors of the hundreds of other individuals here, through the great biopharmaceutical companies who've worked with us, through our incredible partners, FedEx, UPS, McKesson, retail pharmacy chains, our governors, our local authorities, our public health departments. Just want to express our deep appreciation for the commitment that they have made to the American people. Thank you very much. Have a good day.
Thank you, sir. Thanks. That's all the time we have. Please send any follow-up questions to our press office at media@hhs.gov, and I'll turn it over to the operator to close out the call.
This concludes today's conference. Thank you for your participation. You may disconnect at this time. Speakers, please stand by. Excuse me, this is the operator. I just